offer minimally invasive spine surgery, and their patients have seen incredible results. Here to tell us about this surgery are Doctors Azmi Nasser with Arizona Pain Treatment Centers and Dr. T with minimally invasive spine. Good morning, gentlemen. Good to see you.
Good morning.
Good to see you.
Dr. Nasser, let me start with you. What is Ultra MIS?
Well, ultra minimally invasive spine surgery allows us to treat someone's spine using a very small incision and a camera to actually access the disc and safely protect the nerve and treating their pain.
And this really is a cutting-edge surgery. We earlier met up with one of your patients, Suzanne, who had this surgery. Let's take a listen to what she had found out.
I felt like I needed more than just a doctor to take care of my spine. I needed a doctor who would take care of my spirit and my soul and my mind.
And Dr. T, we have some pictures of this surgery. For patients like Suzanne, I see that the outcome is amazing.
Correct.
So this is, tell me what we're looking at here.
So this is the old way of doing spine surgery. It's traditional surgeries, bigger incision, strip the muscles, and longer recovery. And this one is the one of my patients that had the Ultra MIS fusion. It's less recovery, faster recovery for her, and this can be done as outpatient safely.
Yeah, and the incisions, I mean, you can barely see them, Dr. Nasser.
That's correct. It actually is much less traumatic to the spine, and we're able to complete the surgery with those small incisions.
Dr. T, let me ask you, I think a lot of people hear the word spinal infusion, they get scared. Tell me about this surgery and why it's so much better for people.
So nowadays we have new technology that we can do fusion and achieve the same goals as traditional surgery through a very, very small, tiny incision. And less trauma for the patient, less trauma for the surrounding structures, and patient can go back to their normal activities very fast.
That's incredible. And we know we have some pictures to show people of the difference. Tell me, Dr. Nasser, what we're looking at here.
So here what we are seeing is actually the disc replacement implant that we can actually place through a tube instead of actually a larger incision and exposing the spine, which is much more traumatic.
And what is this device?
This is an expandable device that can stabilize the damaged disc. It's kind of like building a chip in a bottle. It's going inside the disc and expand it.
And quickly, Dr. Nasser, let me ask you, who's a good candidate for this surgery?
Usually it's patients that have failed other conservative treatments, which we would make sure, of course, and that have pathology that we will be able to access through this ultra minimally invasive spine technology.
And so many of your patients, like Suzanne, have seen incredible results. Tell me about that.
Well, like Dr. T has said, it's a much faster recovery. They usually walk out of the surgery center, and I repeat, walk out already having relief. So it is fantastic and exciting to see that we're able to help the patients.
And you have a special offer for people wanting this surgery. Tell me about that.
Well, we're happy to review anyone's MRI over the phone and let them know if we think they would be a candidate, and to offer them an appointment to come in to see us.
Such interesting information. Doctors, thank you so much for coming in. We appreciate it.
Thank you.
And if you want to find out more about Arizona Pain Treatment Centers and minimally invasive spine, head to their website, ultraspinesurgery.com, or call the number you see right there on your screen.